Well, hello everybody. I'm Dr. Chosick, and I am a faculty professor here at University of Nebraska at Kearney in the Counseling and School Psych Department. I'm also the director of Beacon in Kearney. So Beacon is out of UNMC, and they are really the branch, the center in Nebraska that deals with behavioral health care workforce. And so it's in that role and capacity that I was asked to take a look at the prevention kind of workforce and develop a 5-year plan to see how to train and get staff onboarded kind of in a systematic way with evidence-based kind of training tools, just to help kind of organize and move the field toward a greater level of professionalization or preparedness for maybe even some type of certification. And so I'm coming to you from my office. I'm sorry I can't be there with you today. I would love to. I have another commitment through UNK. We have a faculty kind of kickoff for the semester, and I'm in charge of that. So I will be busy doing that day, and I know you're also busy. So this seemed like a good solution. I first off just wanted to say that it was an amazing experience to get to work with all of the prevention specialists and staff across the state over the past basically 8 months of this contract to work on this plan. And so I did go into each of the regions. I got to interview groups. So we did focus groups in each region and talked about things like, what they understood the competencies to be in prevention, asked questions about how they onboarded and trained new staff, what kind of tools that they use. And so I gathered a lot of information, from folks out in the field and how it's done. And I did walk away from those focus groups just thoroughly impressed and energized by all the passion that's out there in the prevention field. And so that was a really neat experience for me. I did serve on a coalition here in Buffalo County quite a few years ago, a number of years ago actually, and I know from being a member, it is really a neat process, and to see that going on throughout the state and addressing each area's unique needs is, I just think, fantastic. So the other thing I did was review documents that are relevant to the profession in prevention, some things in Nebraska, some things that are standards, best practices and evidence-based tools. And you'll find that all in the report that you should have available to you. So, the main finding really was that there's a variety of ways that prevention specialists are trained throughout the state. And, it's region specific most of the time, and on what those needs are. However, there wasn't a standard way that people were kind of onboarded or trained or oriented into the field. And since there is a variety of ways to get into the field, lots of different education backgrounds and, maybe just experience backgrounds and things like that, it really does leave kind of a gap, I think, in how some of the new staff, are not quite sure sometimes what all, it is needed in terms of training. And so one of the main ways, though, they said was very, very helpful was on-the-job training. And so being able to watch somebody else do it or work in tandem with somebody who is doing the job really seemed effective. And it's a neat way of mentoring as well. And so that'd be something to keep in your process. The other thing that came away as a good training tool was the SAPST, and that the people who had taken it really liked it. And, it is a great evidence-based tool that I think should be continued to be used. Another thing that is needed, from hearing all the different regions is some kind of guideline or checklist or something that they can follow when they're out in the field doing their work, working with another member that they're bringing on board. So some type of process or system does seem to be something that is needed, that direction from the state level. And then, one of the things that I kept hearing over and over again is how good the tech support is and our technical assistants and those coordinators in each region. They are a wealth of information and resources. They're very appreciative of that and find them very knowledgeable. And so I would certainly want to, build on that strength. So, some of the evidence based tools that you'll find in the report for training are things that are not a surprise. I think they're things that you are very familiar with. One of them is the SAPS manual and that training. I think that should definitely be a key component of any kind of orientation and onboarding process. The CAP training through the SAMHSA, that website is very good. A lot of those are low cost, and the staff who have taken it really like it, and they feel like it's a high quality, and it is a high quality, and it's endorsed by many organizations, and some of even the certifying credentialing things across the United States have recognized that. So I think it's a good tool to use. The Nebraska core competencies also should be continued to use in the training process, and actually make that a centerpiece. All your training building on that, because all of those core competencies include evidence-based tools, and they include the SAPS training, and they include the strategic planning framework. It's just a great document, and kudos to who built that and got that going. Most of the staff across the state were like, yeah, we do all these things, some more to a level understanding than others, but that definitely should be centerpiece in the training. And then also some kind of manual is needed to help train new staff, and I think that's in development. I would encourage continuing of that. That was very helpful for the one region towards the end of my meetings that had that and found it very helpful. And so I think what's left to do probably in that process is develop some type of job description that will help prevention staff know what it is they're going to be doing, what it is that they need to be trained in, really. And the other thing, too, is a checklist. And so that systematically staff can go through and say, I need to do this, this, and this, and then a process for tracking when they get it done. And that makes it, evidence-based, and you have some then validity behind your training process. So in that, in the report, there's a little bit of a start on that, and I left in their region-specific trainings because that was one of the key things. I think a strength of Nebraska is that you're very good about knowing what is needed in your region, and so making sure there's a place for that is really important. So having a standard process, and then this flexibility to do what is needed in each region. And so I did hear quite a bit consistency with flexibility, and I think that is such a great concept and something to hang on to. And then lastly, the report just encourages continuing to work towards certification, professionalizing the field. The work that is being done is fantastic, and we want to make sure that's recognized and the people are recognized in a very professional, credible way. And so, if there's any questions on the report, please don't hesitate to get a hold of me. I want to thank Renee and Nikki for their help in this process. They're fantastic. I think the state's in good hands with the two of those at the head of this prevention efforts, as well as all the coordinators who helped me get the focus groups going, and all the people I met along the way. It's just been fantastic. So I hope to see you sometime again and work with you again in the future. So thanks again. Have a great rest of the summer. Bye-bye.